basically what happens, most of you, if you've ever been to a chiropractor, if you've been here, great, but this is going to be really the other side because you're usually here face down, you don't really know what's happening. So what I like to do is I like to start with this area here. This is the thoracic region, and I've already done the evaluation and I know exactly which areas we're working to address as part of the plan. So we get onto those areas, make sure that we're at the right spot, and then adjust. There we go. And from there, we can balance the hips and the pelvis, and that helps a lot of this low back pain. Happen to know that Emma stands a lot of the day, and that she gets some issues down here too. So what I'll have you do, go ahead and turn on your side. You can face me, please. There we go. And if we can get just the right amount of specific motion, take some stress off the spine here, tip your hips up just a little bit. There we go. And then we'll come around here. Same thing here. Good. We'll do one. That was it. Okay, then face up for me, please. All right. Now, as far as the neck goes, once we know which point of the neck is not moving right, then we can really find it. Perfect. Great. Let me set it right back down.